Hello and welcome to another episode of Movement Therapy. Today we're going to be focusing on our hips and a little bit of our lumbar spine. And what we're going to be focusing on is internal rotation and external rotation. So you should feel a lot freer pretty much all the way around your hips. And a really good way to notice this kind of tightness or tension will be pretty much apparent from the very first exercises that we do. But I'll give you another couple of metrics so that you can see the change that you're going to create in the body as we come along. If you've joined us before, we always start in a really similar way. If your first time, welcome. We're going to take ourselves down to the floor here, and we're going to put our feet just over here with heart and our arms out. I slightly make sure you're coming off space and you don't hit the wall. But I really want you to focus today on the speed of this. Taking it nice and slow, just letting your knees fall. Don't push down or don't try to gain any extra centimeters. You're just really noticing how that feels and what's happening through there. And what I can feel straight away today is my right hip feels a little bit gout. It's a good word for it. Now I'm going to take the leg right in the top and give it a swing. And then we're going to come back and repeat on the other side. And the same rules apply. We're just noticing, just seeing if there's anything there that maybe we can change for you in 20 minutes time. Let's do one more of each. Focus on your breath. Let it out. Then we're going to come back to our original one where both knees are going to fall to that one side. Our hands are still out. You're going to take the hand that's close to your foot, reach it overhead for a big rainbow, reach as far as you can. And you continue that kind of reach as we make a big rainbow or a big circle arc over the top of your head, trying to get your shoulder back to the floor, all the way back out. And let us repeat through those on the other side. Now remember, if any of these movements feel really good for you today, just hit the pause button and give it another go. Now for me, particularly in this one, I can really feel that kind of ghostiness happening on both sides of my hip there. So this will be something to see how we go with it. I'm excited. Let me be excited. So we're going to do this up into what we call a 1990 position. We're going to come back to those first three exercises as our metric for today. But for now, seated down like this, we have a couple of options depending on how mobile you are. So you might need to put your hands behind you and then travel your knees towards the opposite way, letting them fall where they fall, and then coming back towards this way. Now, if you're doing that pretty easily with your hands on the floor, then you can take it to one hand or no hands and just start to let your body press down into the floor, and you're trying to lift your spine and your head up, not crumble. So you're really trying to keep yourself lifted. And I don't know if you can tell, but some of you might switch a little bit forward as you do this. That's really okay. Just reset yourself. Now we're really working the internal, external rotation of our hip. We're going to come back to where we first started. And we're going to take some movements here. So when you can, try to get that leg in front of you with shin at about 90 degrees in front. And let that other leg go where it feels comfortable for now. Now we're going to add a reach forward. You're only going to go as far as you can. Now if that's all the way down, amazing. But you have to have enough strength and enough mobility to be able to come back. So this is the key. Breathe out. And you might feel your body just start to let go as we do a few more here. 2 more in the center. Now I'm going to do the same reach, but this time I'm going to go over the knee, the front knee. You're going to reach forward here. And you come back. Now remember, if your reach is here, That's totally fine. You're not trying to compare yourself to me. You're not trying to compare yourself to Kat, who may be stretching out like you're absolutely next to you. Definitely don't do that. But you're just trying to see where your body can go today. Now we're going to get a much smaller movement, but we're going to try to reach over the opposite knee now. So we're going to reach this way and come back. Now it's okay if you don't go as far. As you can see, I'm not going as far. Some of you might be very limited here. That's completely fine. Remember, we're not trying to push our body to the boundary. We're just trying to ask you where it wants to go today. And then we're going to finish up with our reaching. Now we're going to do some bends. So you have two options here. You can use this hand as a buffer and try to reach over, creating that stretch through here. If that feels a little easy for you, you're going to come all the way down to your elbow and that reach and come back. So slide that hand down. Come back. Let's continue this. Here you go. Are you breathing? Now we're going to reach to the other side. The difference here is we're not trying to side bend. We're trying to reach for the top corner of the roof. Trying to lift this part of your rib off your hip and come back. So using your arm to facilitate that lift and come back. Remember to breathe. Exhale. Two more. Fantastic. That's one hip mobilized. Now, if you'd like to, you can just kind of shake that out a little bit. Come back to a little bit more of a neutral position because we are going to do the other side. So we're going to set ourselves up here and we're going to rotate first again like we did before. So remember, if you need to take your hands behind the back and flip one way to the other. If you don't need your hands, just lengthening that spine, trying to stay upright and as tall as you can. And if you find yourself running away, just stretch back to where you need to be. Beautiful. All right, let's do one more here. Fantastic. So settle yourself into this 90-90 position and we're going to add our forward reach. So you're in the center, just reaching as far forward as you can and coming back. Now I already feel a little bit more restricted on this side compared to the other. I feel a deep stretch up here. I feel a deep stretch here. It's all happening. And that's why we do both legs. One. And essentially, we're just trying to get as much movement into that hip joint as possible in as many different directions. Your hip is one of the most mobile joints. We're going to do two more. And so to keep it mobile, we have to try to hit all of the range of motion. Let's take it to the knee at the front here. So reaching forward. I found a bit more range there, but I can definitely feel this hip. Now remember, at any time we're going to be in pain. Pain is your body's way to tell us that's where it doesn't want to be. You might find a bit of discomfort, a bit of stretch. You might find yourself sweating a little bit. I'm okay with a little bit of sweat. It's your body getting rid of some water, spaces there, pushing it around the body. Now we're going to move this way. Now again, a lot of us won't have a lot of movement available to us this way. So just take it gently, 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 and breathe. Very restricted this way. Last. Time for those side bends. So remember, you can come to your hand and reach, trying to lengthen through the side of the body. That's a little easier. We take it down to our elbow and lengthen. Feel like that is the one for me today. And you might notice that as you move through all of these different exercises, that you've got one or two movements there that you're like, yeah, that gets in exactly where I need it to be. And so if you are finding that, remember you can press pause and repeat those ones, or maybe repeat them when you're finished. Last one here. Let's go the other way. So remember, this one, don't reach more to the roof. You're trying to lift your bottom ribs off your hip. Couple. Last one. Oh. Whew. Yeah, I've got a little bit of sweat action happening. I definitely feel some differences. How do you feel it? Hopefully you're noticing some things. Now we're going to go into our all fours position. And we're going to gently mobilize the spine. We're also going to mobilize through the hips again. Our first one that we're going to do, we're going to be pretty simple, is cat cow. So you want to create that arch in your spine, lifting your chin if it's available, and then tuck it in. Remember, never push through range that feels like pain. You're just trying to find the edge of discomfort, edge of your range of motion. Fantastic. Well, but also going to do now is then walk our hands forward of your shoulders. And we're just going to push back into our hips and come back up. And a little jolt, almost like a knee push-up position. Down, drop, almost to push-up position. Fantastic. Now we're going to repeat these motions, bringing our hands back under our shoulders with some staggered movements. So I've chosen to bring my right leg forward, my left leg back slightly. You don't want to go too far, but you don't want to make it too little either. You need to find that nice Goldilocks right in the middle. And from here, we're going to cow again. Definitely feel some things happening at my hip there where it feels a little gunky before. I hope you guys are feeling good. Fantastic. Now, this time, as we reach back, what I'm going to get you to do is try to reach and stay in the center. Don't let your hips swing off to one side. Now, this will be quite challenging, but what this is going to do is going to help our hips move independently of each other. And I want them to turn. So we're going to keep them going straight. Now, you don't need to get far in this, and that's fine. Last one. Fantastic. Now I'm going to switch. So I'm bringing my left leg into that stacker, hands are under my shoulders, back into cat cow. Oh, it feels good. Feel it listening out. It's a very nice feeling. We're going to keep breathing. Fantastic. All right, let's try that reach. So think flat, trying to stay centered. Now, I definitely have a lot more movement on this side. I don't know if you can see that at home, but you'll find that you'll have one side which just want to go sideways and one where it has a lot more room. So making sure that you find that nice and range and your hips are moving as they should, not trying to creep in a little extra movement and negating the benefits of what we're trying to do here. Last one. We're going to do just one more. And I said loving to call this Miley Cyrus. My yogis might hate me for that, but we'll see how we go. We're going to take our knees wide and our elbows right in front of us. You're going to find a point where you're feeling that stretch in between the legs there. Now, from here, what we want to do is we want to drive our hips back and forward. Or, it's just kind of like a nice, slow, gentle work. And back. Now, as we're doing these movements, we're going to add a little bit for our spine. So I'm coming back over your elbows. You're going to choose a hand and you're going to bring that hand forward as you accelerate it back. And then we might just switch. So a few more. Reach. Let's go back. Reach. 2, go. Last 1. And then walk yourself back into here. Now, our last one, just to make sure our hips are moving well, so we're just going to come into a forward hip flexor stretch. So we're just going to take our knee under our ankle under our knee. And what we're going to do is we're going to tuck our hips under and try to lengthen through that spine again. Now, already some of you might feel a little stretch here, but if you want to take it just a little further, keep that hip tucked and just add a little lean. So again, we're trying to take the ribs away from the hip, but keeping that hip pushing forward this time. Release. Let's just do one more of those. So tuck that hip under, lean into it a little, and reach it over. I'm going to stake this way so that you can see the difference. So change legs. Remember, we want to tuck the hip, lengthen through our leg. Arm comes up, and if you can, over. One more, last one. Tuck, lift, reach. Fantastic. We're going to stand up and give it a little wiggle. Yeah, I feel the difference. I don't know if you can feel the difference yet, but we're going to test. So let's start back where we were, feet width apart, laying down on your back, hands coming out. Your feet can go a little wider than the hip width, and we just let those knees drop. And you want to notice, does it feel different? Mine definitely feels a lot different. Perhaps I feel like my knees flop down much closer to the floor. It's a little bit easier. I still feel a little gunkiness happening at the hip, but it's much nicer. So let's try to roll, swinging that leg. Lift to the other side. Again, noticing what you feel. For me, that's a little easier again. And then just letting both knees drop to that one side. And then in our overhead rainbow. Now, if this has felt like this before, it feels like even better now. Flip to the other side. Yeah. That gunkiness of the hip is definitely better. Fantastic. Slowly sit yourself up. Thank you so much for participating again in movement therapy classes. I hope I see you next time. And remember to send through any requests for body parts. Thanks, Sam.